Well, first of all, my picture says I'm Bill Mills. I'm not his twin brother, although we do work very closely together. So I don't know why that says it, but I am Tom Ogg, as Barbara said, founder and president of a company called Development Partners in Healthcare. So anyway, I'm glad to be with you. Like I said, I'm an RBMA member since 1981. That might be before some of you were even born, but I'm a proud member of RBMA, and I was a wet behind the ears practice administrator and director of a billing company. And RBMA was truly my MBA when it comes to not only radiology, but the whole medical practice world. And so I have great respect and gratitude for all what RBMA has done for me and my career over the last 40 years. I did found my consulting company, Development Partners in Healthcare, in 1998, 23 years ago. And during that period of time, is both within my 40 years in radiology and my last 23 years as a medical consultant, I have seen a lot of changes. I'm sure many of you have. We've gone through declining reimbursement. We've gone through government regulations and impingement on the freedom of physicians to practice medicine. We've gone through technological challenges. We have gone through patient expectations increasing dramatically. And certainly in the last couple of years, we've gone through the pandemic. And through all of these, I've worked with my clients to try to better them and help them be financially and clinically successful in what they do. But more recently, the pandemic has exacerbated a situation that has developed over the years. And that is why you're hopefully on our webinar today. And that has to do with the area of burnout. And over the last several years, I have been looking for ways in which I could help my clients through this most difficult time. All the other challenges were significant. This one is debilitating to so many of my clients that it almost prevents them from really moving forward and getting their work done in the way that they want to do it. And so I've been searching around to help my clients find solutions, and was able to partner in the start of this year with a company called Best Upon Request, who has a concierge services that I have found as being one of the more concrete, if not most concrete, solution to this issue of burnout. And so I'm proud to be a partner with them and to be able to bring their services to my clients. So that's who I am. I'm glad to be with you. So happy that you could join us today, and I'll turn it over to Bill.
Thank you, Tom. And my name is Bill Mills, and I'm the president and COO of Best Upon Request. As Tom said, we're a concierge services agency, and our work is with employees of companies, particularly in healthcare. And we also work with patients in healthcare. And so we're very knowledgeable, and we're students of the healthcare industry and what's going on. And many of the things Tom talked about are key drivers of things we help to support. So in particular, we serve physicians. And so I come at this from the frame of reference of working with physicians to help them improve upon work-life challenges, and in particular, help them resolve burnout issues and burnout symptoms. I would also say that the first half of my career, which you can tell by my hair color that is quite extensive now, the first half of my career was spent in automotive, electronics, and electromechanical manufacturing with a Japanese company. And so I have a manufacturing mindset that is really focused on continuous improvement and problem solving, and helping to understand how do we get to the root of things and how do we solve those. So I come at you today with knowledge both of the healthcare industry and physician need, but also from an understanding of what does it take to truly solve for some of the things we're struggling with. So I thank you for allowing me to be part of this webinar today as well.
Next slide, Will. You just went through a presentation on recruitment and retention. I applaud RBMA for putting these two subjects together, because we really believe there is a direct link between them. I'm going to share with you in a few minutes some information that I was able to get from my clients about this subject on burnout, and was interesting some of the strategies that they are trying to employ or some of the symptoms rather that they are seeing with their practices in regards to burnout. Is people wanted to retire early, people wanting to reduce their work to a part-time status, to actually leave the organization and see greener pastures. So one of the ways that you can combat that is to deal with the issue of burnout. And so if we're going to hopefully be able to help you with some of that this afternoon, and help to stem the tide of physicians who want to leave your organization early, retire early, or to go to some kind of a part-time relationship. So a very direct link, we think, between the two presentations that you have today, and hopefully you'll find ours as helpful as the last one. Okay, Will. Just a little bit of a history lesson on this whole subject of burnout and where it comes from. It's an interesting word, and in the early 70s, it was really coined as it referred to people who were heavy drug users. And so it's really a debilitating, obviously, thing for those folks back in the early 70s. But then in the mid 70s, it transferred into the whole medical practitioner world, in which they describe this as a loss of will among practitioners. So people who are practitioners, and this also included other helping professions, not just the medical. It included counselors and therapists and actually even teachers, that in the 70s, they find that folks were really having a loss of will in the way that they do their jobs, and an inability to do them because of their work with addicts, because they were getting burned out just as their clients were. And it wasn't until the 1980s it became a popular way to describe exhaustion and disquiet at work, and it moved out of just the medical arena or the caring or practitioner arena, and it moved into all aspects of society to describe exhaustion and just disquiet with your work performance. So that's a little bit of history over the last 4 years. Okay, Will. There's been a lot written over the last several years back into the 70s about burnout, and one of the more familiar names is Maslach, who's created a burnout inventory. There's a quote up there that I find particularly interesting and a little bit sad, but also helpful to think about the whole idea of burnout. The idea that it's an erosion of the human soul, that's an erosion in values and dignity and spirit and will among people. And what this really tells me is that we need practitioners to be soulful in what they do. They get into the helping profession, particularly healthcare, because it's a heart call. They want to help people. And what we're seeing with burnout is that it is really eroding that desire, if you will, to serve other people, because they almost become debilitated by the whole experience of burnout. And so on the left-hand side, those people who are fully engaged, they've got great energy, they've got involvement, and they've got efficacy. But when they become burned out, you see things like exhaustion or cynicism. And I think cynicism is one of the things, again, I'll share with you a little bit later, and some of my comments from some of my clients really is eroding of the spirit of the organization, not just the individual. But when you become cynical about your job, cynical about the serving that you do, cynical about your work, it really does erode the soul of not just the individual, but the entire organization. So those are some transitions that we see when people become burned out. Okay, Will. So what are some of the other origins of burnout that Maslach and a researcher called Leiter have found? The list there, I think you probably have recognized some of these things in your own practice. With the increasing pressure to be productive, you see overload in work, and then the lack of control of the work. And I particularly see this with my radiology clients. When they come in the morning, the radiologists, and they sign on, it's just one after another, after another, after another of cases that they have to read, and they really don't have much control over the flow of that. They have to continue to try to keep up with what is happening in their practice. The other one I'll comment on is a breakdown of community, and perhaps you've seen this in your particular practice as well, is that it really produces a kind of an angst that you have to deal with as administrators or managers in your practice. There's kind of a breakdown in this community spirit. So I talked about the erosion of the soul on the previous slide. It also has an erosion of the practice soul, where people begin to pick at each other and point fingers at each other. And instead of trying to come together to solve what they're doing, they're pointing their fingers inward, and it really makes it a worse situation than it already is. So those are some of the origins that Maslach and Leiter found when they did their research back in the 1970s and 80s on the origin of burnout.
Tom, when we think about those burnout creation examples or symptoms sometimes, or potential causes, and I look at the graphic, it reminds me of how complex an issue this is. This graphic actually communicates a couple of things. Number one, it could be representative of this progression that folks go through as they become more and more burned out. And it's slow and gradual, and we don't always realize that it's happening. So that's number one, it's a progression. Number two, there are probably people in each organization who are experiencing symptoms to different degrees. And so it's complex in that it's not one thing, it's constantly moving and it's constantly burning away at the organization and at each individual within.
All right, next slide, please. I did an informal survey of my clients, and since I cut my teeth in radiology, probably 70–75% of my consulting clients are radiology groups. And so I took a number of them and I sent them a very informal survey about, what are you seeing in your practice? What are some of the signs and symptoms that you're seeing in your practice that you think are attributable to burnout? And I think it's an interesting list, to say the least. And I would imagine some of this sounds very familiar. As I mentioned earlier, you see people who want to do early retirements. You see people who want to go to part-time. I have a client that has 21 radiologists, and 11 of them in the last 3 to 5 years have gone part-time. Well, obviously that puts pressure on the rest of their organization to be able to keep up with the work and to get it done. Leaving the organization for greener pastures. People, and again, we're seeing lots of consolidation of groups, but also people becoming employed by health systems. And so people striving, trying to get out of the situation they're in because of these symptoms of burnout. On the right side of that screen there, you see irritability and angry reactions to any changes. So it makes it more difficult for you as administrators and practice managers to really often work with the physicians in solving some of these problems, because they're just angry. And so when you're angry about something, it makes it even more difficult to try to solve them. Hostile verbal exchanges between partners. I would imagine sometimes those of you in the audience are getting in between some of those. And again, the organization is becoming debilitated by their inability to solve problems, because we're just angry about them and we're picking at each other as opposed to really finding a way to solve our issues. Decreased productivity. Again, it slows people down. It distracts them in lots of ways, and it prevents them from being as productive as they want to be or they need to be. And maybe the worst one of all is apathy. They were called to this profession. They were called to healthcare to take care of patients and to heal. And the fact that it's sometimes difficult for them to get out of bed and not care about it anymore, because they are just so very, very difficult having signs of these symptoms. So hopefully some of that, not hopefully, but I imagine some of that sounds familiar to you. Okay, so will we move to the next slide?
So it really begs the question at this point, if the signs and symptoms of burnout are so prevalent and consistent, then why are the root causes and legitimate preventive solutions so elusive? So I was thinking about this from the standpoint of radiologists and what you do. And in radiology, you can read a scan, you can provide a very clear explanation or root cause analysis of what the patient is experiencing, and that gets reported to the physician, and ultimately a treatment plan can be derived from that. And my guesstimation is also that there are sometimes when you read a scan, you can identify what's causing the patient's problem or pain, but understanding the path to treatment could be more difficult because there's complexity there. And so it requires collaboration. It requires collaboration with other radiologists or with the practicing physicians so that everyone's thought is coming to the center to really identify what is the course of action from a treatment standpoint. I would submit to you today that addressing burnout is one of those more complex issues. When we look at a scan of burnout, we see these symptoms that we've been talking about, but it's not one of those things where we can go, so the thing to do is. It becomes more of the steps that we need to take. It's not one thing, it's several. It becomes a collaboration between the physician and the leadership team and the radiology group. And so it becomes a much bigger challenge that requires collaboration. It requires time, focus, effort, energy, and often investment to really get to the root cause and what to do about it. And so Tom, a few moments ago, talked about Maslach and Leiter's burnout creation and what causes burnout. And they also offer in their research how to prevent burnout. And so relative to the things on the left come a sustainable work overload, or feelings of choice and control over lack of control, recognition and reward over insufficient reward. And what these really are guideposts. They're not the how-to. And so while we understand what some of the challenges are and some of the opportunities for improvement are, we really don't have a roadmap for how to get to what is the solution, what is the actual prevention. And so we see these things as opportunities to better understand. They're guideposts to guide us along the way for solving for burnout and truly having an organizational emphasis that is in fact improving upon the conditions that cause burnout.
And Bill, I would just comment that the list on the left is very similar to what I shared with you a few minutes ago that my radiology clients shared with me in terms of burnout creation, what's causing it, and so it's very similar. So it's very consistent, I think, with what we're seeing in our practices, with what the researchers have looked at as well. And again, on the right-hand side, that number 4 again stands out to me, a sense of community, because what we're going to talk about a little bit later on is culture in an organization. So again, that is being impacted seriously in our practices because of how burned out people are and how distracted they are and unable to function as they had functioned before.
And so while there are recommended preventions and best practices available, there's little data that suggests what actually works. It strikes me, I don't work in healthcare, but I serve healthcare. And so I kind of do work in healthcare. But what's interesting to me is that when there is a medical problem with a patient, there is typically a medication, a treatment, a surgery, something that can be done for the patient that has been medically trialed, clinically trialed, to know that there's a good chance that this medication or treatment is going to work. And what strikes me about solving for burnout in healthcare is that there's very little data on what actually works. There are few clinical trials for how to solve for burnout. We're still at this place where we're struggling with symptoms. We're struggling with the idea of where did it come from? How does it happen? Who's it affecting and who isn't it affecting? But ultimately, we need data and we need more hypotheses around what might be the root cause so that we can then, in fact, institute good countermeasures and measure the success of those things. And so when we think about it, and Tom and I have said root cause a couple of times now, again, working for a Japanese company many years ago, anytime there was a problem, someone would always ask the question, what's the true root cause? Not just what's a root cause or what are the root causes, what's the true root cause? And what that means is not what the symptoms are, Not what is it we're trying to fix in this moment, but what is lying beneath that, what's under the surface that is truly causing the experience we're having in this moment, or the experience the customer, in the case of healthcare, the patient is having in this moment. So understanding true root cause is absolutely critical to solving for burnout. So another question, is there an overarching message to be understood that can help guide our strategic thought going forward? And Tom and I have had lots of conversation about this over the last few months. And I mentioned an analogy earlier that a radiologist can look at a scan and suggest give a report to a physician, a practicing physician who is going to begin to work to solve a patient's issue. I'm actually going through this process right now with a lower back and hip issue. And I recently read my x-rays and the report that the radiologist provided. My radiologist has identified things that are unremarkable and things that are remarkable. The report didn't say there are remarkable things, but there were lots of remarks about what those things were. And one word that I read in my report was degenerative. And so we can identify what the problem is at that level. And more than likely, my physician will be able to look at that report that sort of centers on there's degeneration, and he's going to be able to say, Bill needs physical therapy, Bill needs surgery, Bill's going to need to kind of take it easy for a while. My surgeon will ultimately know, do I need surgery or not, or is there another treatment that will suffice? My assumption is that in some cases, and hopefully not mine, the radiologist, the physician can look at my x-rays and go, is there something else going on that's causing the degeneration? Is it more than just addressing that? And so maybe there needs to be a deeper look into the problem. In problem solving, looking beyond the surface, looking secondarily and looking at the tertiary causes and beyond that, that's the act of asking why 5 times. And so I would submit to you today that taking an approach to not be satisfied with the first conclusion you come to when it comes to physician burnout is going to be a key for actually resolving burnout for your organization and for the individuals within your organization. Again, asking why more than once. And really, when you get an answer to the why, then ask, why did that happen? That's going to be critical. And then finally, you can't really solve a problem unless you're listening to the people it's affecting. That's why it's so important for a physician to hear from a patient and understand what that patient is experiencing. In the case of physician burnout, the question is, are we listening to our providers? Are we giving them a voice? Are we asking why 5 times? Tom mentioned that inter-office conflict or apathy or other things are going on. We have to get to the root cause of why are these things happening. If we can understand the why behind them, we can begin to solve more effectively. And so what we'd like to do is share with you some data from some publications that we've reviewed and have taken interest in, because we believe they help really point toward solution thinking, problem solving thinking. And so Will, if you could advance to the next one. The first article that we'd like to share with you is from the Journal of the American Medical Association. And it was an article published this year, very recently, I think in May, on personal and professional factors associated with work-life integration among physicians. What I can tell you about the article is that they sent out 20,000 surveys. They received almost 5,200 responses and 4,370 what they call completed responses. I'm assuming they gave context for some of their answers where requested. But ultimately, this is a qualitative and heavy on statistics survey that was done late last year or this year, and the article was published in May of this year. We're going to take a look at a couple of slides that kind of drill down into the research and the implications. So first of all, key question in the survey was, during the past week, how often did this occur? And the conclusion phrases were: skipped a meal, ate a poorly balanced meal, worked through a shift with no breaks, arrived home late from work, had difficulty sleeping, slept less than 5 hours in a night, changed personal or family plans due to work, or felt frustrated by technology. And I'm sure these are all things that our listeners can relate to right now. So from those questions, let's take a look at the next slide and where it really gets into. So we have a technology issue. And so I can tell you what the slide says. The highlighting is actually covering the letters for some reason. But the premise of this research was based on the fact that physicians work long hours, inflexible schedules. They're doing work, and this is especially true for radiologists, that is emotionally taxing. And you don't necessarily in those moments have someone else to lean on. The culture of patient first over personal needs, and then finally conflicts with work and home. And then it focuses on outcomes, burnout, the intent to reduce work hours, all things we've talked about so far, the intent to leave practice, and or the impact on relationships with their children. And in particular, an interest in how this is affecting women in the workplace and as physicians.
I think the interesting thing about this particular research and this slide is that, to me, a dichotomy begins to emerge. And that is, and what I've seen in some of my client organizations is that the burnout, the organization is attempting to do some things for their physicians around burnout, but they're leaving the home part of it or the out of work part of it to the physician themselves. And so one of the things I think is critical to remember is that, this work-life integration, it's hard to separate that, because the impact of the work experience is being taken home and being manifested itself in relationships within the family, within the whole social atmosphere that they live in outside of work. And so one of the things we think is very important is that to understand burnout and to understand solutions, it's good that organizations want to address that and think of things to do it. But to leave the physicians on their own with what's happening at home is going to limit the ability to solve those issues. And so I think we can't be saying to our physicians is, we'll work on it here and you take care of it at home, because they are so interwoven with this whole work-life integration that's going to be a strategy that's probably going to be insufficient.
And so in the statement of importance for the article, it really zeroes in on what Tom just said, that poor work-life integration is kind of equal to the relationship between career and personal when career takes priority and there's conflict in those two things. Will, if you, yeah.
So some other conclusions to the JAMA article was they found that work-life integration was reported by physicians who are women, single, age 35 or older, and who work more hours and call nights. These findings suggest that systemic changes need to improve work-life integration among physicians. And what often I've seen in groups centers around female radiologists. And the latest data I have, it goes back a few years, but it seems to indicate that about 25% of radiologists are females. But where I've often seen conflicts with my clients in that is that when women who are oftentimes burdened, although this says single women, that doesn't mean that they don't have children at home, but the female radiologist is still left with a lot of home responsibilities that sometimes, and I know I'm generalizing here, that sometimes the male physicians are not as taking responsibility for. And so it really does as a double whammy on the female physicians. But what's interesting in some of my clients, what I see them doing or thinking is that because the women have these responsibilities and sometimes are looking for help with that, or reduced work hours or different schedules is that they're not as committed as the male counterparts in the practice, that they think it's a work ethic issue. And this oftentimes creates additional issues among the groups as finger pointing within the organization. So I think these conclusions are very important, that we need to understand that some members of our practices are being impacted more than others. And this seems to indicate that from a work-life integration issue.
And so another article that is really, really good, I highly recommend you to reach out and get a copy of it on the internet, but it's by Medscape and it's called Death by 1,000 Cuts. It's their 2021 Physician Burnout and Suicide Report. And one of the questions they ask in the survey is, what contributes most to your burnout? And I've taken the opportunity here to overlay hourglasses by each of the contributors that involve the element of time. Either it requires additional time or it is indicative of a loss of time. And so if you look at the chart, and I won't read the things to you, but I will say that 5 of the 10 specific answers given as options involve time or time loss. And the top 2 are directly related to work-life integration in particular. So the idea that what is contributing to burnout, to not realize that time is a critical piece of that, would be a major error on our parts. So we have to be mindful and understanding that burnout is a result of an issue with time. And similarly, another question they asked was, which workplace issues concern you most? And again, they broke this data down by male and female. And I've taken the liberty to give a balance scale beside 2 items that relate to work and life, or work-life integration or work-life balance. And so the first one is in fact work-life balance. And please notice that when you ask physicians what is the biggest issue that concerns them, it's more than twice any other answer. Generally speaking, it's work-life balance. And when you go down to the third one, combining parenthood and work to work-life balance, that's kind of the big work-life balance issue. And you can see in the data there that 59% of women and 54% of men chose those 2 things as their biggest issues. Everything else on the chart pales in comparison. So there's that work-life integration issue again. And so what we would like to do is offer a hypothesis to you today that burnout most often occurs when work and non-work personal commitments come into unavoidable conflict and work wins. I want to just let that land on you for a second, talking about work and things that don't involve work. Conflict. We've heard the word conflict. Tom heard it in his research. We've read it in the articles we've looked at today. When you think about that conflict, the one thing the articles often stop short of was saying who wins. But it's the idea that when I have to let something personal go, something very near and dear to my heart, part of the reason I exist, part of the reason I even work, when I have to let that go because of work, that's a loss for me. It's a loss for, and going back to the word Tom used very early on, it's a loss for my soul. And so these losses eat away at our soul. And then the last piece of information we'll share from the Medscape article was the question, how are you keeping up your happiness and mental health? And there are those darn hourglasses again. Everything that has to do with time when it comes to keeping myself happy and maintaining my mental health as a physician, radiologist, those 6 of the 6 specific answers all require time. If there is no time, if I'm forfeiting time to continue working, then I am absolutely letting something else go that is critical for me to maintain my happiness and maintain my mental health, potentially maintain my physical health and my family health as well. But it's one big balancing act. That's the point of the data. And so I'd like to just share this picture with you, when there isn't enough time, work wins, or work typically wins. Maybe that's not an always statement, but it's a usually statement. And I want to just share a quick story with you. Again, we're in the concierge business. And so I, on occasion, have the opportunity or endeavor to take the opportunity to interview physicians that we work with, that we're serving. We're part of their organization, and they choose to use our service to be able to better integrate work and life. And I was on the phone with a physician. She's the mother of 4, and she has a newborn. This is some time ago now, but she had made the decision to breastfeed her newborn. That's a family decision. That's a personal health decision. That's a decision for the health and longevity and development of her child. And it's a critical decision in life. And she said to me, Bill, I'm a family practice physician with a lot of female patients. And when they have babies, they want me to deliver their baby. And it's not unusual for me to get a call at 4 or 5 o'clock in the afternoon to have to go and deliver a baby. I may be at my office ready to head out, and what's on my mind in that moment is feeding my baby dinner. I've pumped all day long, and now I have the opportunity to go home and feed my child and act upon the commitment that I've made to my child. But I get a call and I have to go deliver a baby. And when that happens, I'm faced with this conflict that we've been talking about. I'm faced with, do I serve my patient or do I serve my child? And so it's this idea that there are very real issues that as radiologists, physicians, you're dealing with that have to be dealt with. And unfortunately, there aren't a lot of alternatives. It goes back to that loss of control. I have to serve my patient. She's expecting me to be there. And so I have to find another way or hope something works out as a secondary option for my personal situation. As I mentioned, in my work, I have the opportunity to interview and speak with physicians and physician leaders, radiology group leaders. And last year, our team conducted physician interviews, very formal interviews, and we created a 2020 impact report. And we're doing this to not only understand how our business can be more effective in the space, but to really understand what's going on with physicians and how can we refine what we do and how can we guide our prospects and our clients to a better understanding of how to solve for this issue of burnout. During those interviews, the recurring themes that came up, there were 5 of them, and they're the same things we've been talking about. Time, family, pets came up a lot. Who takes care of the pet? How do I take care of my pet? Food or eating healthy as a family and providing healthy options and choices, especially for female physicians. And then life itself, doing things we enjoy doing. I think the big aha moment for me in the research was the realization that we already knew this, but it's the idea that physicians are people too. Not only are you as radiologists reading scans all day long and truly holding people's lives and their an in-depth and thorough and accurate understanding of their medical conditions in the palm of your hand, what's weighing on the back of your mind is that you may have an elderly parent that you're trying to take care of, or parents. You have children of your own. You may have a family member with cancer. You may have special needs children. You may be a mom. You may be a single mom or single dad. You've experienced death, and you occasionally experience death in your family and with friends, just as everyone else does. And I love the last one. You also sometimes forget. And so it is when we forget or when we deal with struggles and events in life that these conflicts are most exacerbated and most challenging. So these are some things I heard from the physicians that we interviewed. During the interviews, I asked one specific question. And of course, the question was coming from the frame of reference of a concierge company who's providing time-oriented services to physicians. But for the sake of understanding for this conversation, let's just say when we're asking a question of if you had a service, any kind of service that gives you access to more time, why or how are you using it? And so it's really a question of, are you using this time-based resource for your personal wellness strategy? 97% of the people who answered that question said, yes, I absolutely am. And we ask the question, are you using the service as a way to keep work and life in harmony? 100% of them acknowledged, yes, this is one of my key things that I am accessing to maintain my own work-life balance. Is it a way to spend time with your family? And is it a way to stay focused at work? I'm not worrying about home things when I'm at work, and 97% answered affirmatively to those two questions as well. So I think the point here is that the anecdotal and it's very specific and real, but the data that Tom has been able to glean in his practice, the data that I've been able to glean in my practice, it all aligns with the public data that we've shared with you today from Medscape and the AMA, and that is that work-life integration and the things that drive or allow for healthy work-life integration are absolutely positively critical to how you solve for burnout. And so that brings us to, points us toward the end of our session. We've got about 10 more minutes and we're going to wrap up on time, I believe. And we want to offer to you the suggestion to think about, again, the 5 whys, asking why repeatedly to get to the depth of an issue. And so in this case, why does this conflict that we've identified already, why does it occur? And so as Tom and I have sort of delved into our work with our clients, we realize these 5 things: a lack of organizational awareness, in other words, low work-life integration, a lack of organizational work-life strategy. Organizations, for the most part, aren't dealing with this. They're, as Tom said, they're focused on the organization and they hope their physicians and radiologists are focused on the home part. And that idea that work leaves us no choice. As we said earlier, work typically wins. It is our default. Lack of individual control over time. We've talked a lot about control in the last few minutes, and things come up, things are planned, but many of the things that hinder us at work and keep us from feeling as though we have work-life integration or a healthy work-life integration or work-life balance, it is because of a lack of control of time. And then finally, an overall lack of time. I think we would all say there aren't enough hours in the day. And so what do we do with the hours we have really becomes the question, and where we begin to solve for the problem.
But one of the things I've seen with my clients, and this goes back a number of years, this isn't just pandemic related, when physicians were able to begin to have computers at home to read scans and, be able to do nighttime shifts and things like that, and be in their home and so on. I think this speaks to that, that is one of the options that's certainly available to radiology groups, that they can provide that. But again, the pushback a few years ago was from the older physicians who said, we need you in the hospital. We need you to be in there. And for good reasons, to interact with referring physicians and so on. So some of the groups have said, we want to offer that service. It's not something we always want our physicians to be in the home and not in the sites where the scans are being created. But it does point to the fact that, again, there's somewhat of a generational conflict with some of this stuff, that, if you're a real radiologist, you'll be in the hospital with us. Whereas we're finding some relief for some of our groups. They're able to read scans right from their home, and being able to maybe do some of that more work-life integration. So it provides a solution, or at least one answer to that as well.
So as we think about the things that are opportunities for us to solve, let's think deeply about developing strategy for 2 things: culture, a culture that supports work-life integration, and how do we optimize time. So in the moments that we have left, Tom's going to talk about culture and I'm going to talk about optimizing time. And we hope that the things that we say will be something you can take and really take action on going forward within your organization.
This is going to be challenging for me, because I believe culture is the difference maker in any organization. I used to think culture was a bunch of hooey until I ran a large company back in the mid-1980s, and I had people leaving our organization in droves. And I finally had to look in the mirror and said, you are the problem. that I was the problem, not creating the kind of culture where people wanted to be around. I was taking the family vacation through Atlanta, Georgia, at 2 o'clock in the morning. Everybody's sleeping in the van. And I looked up at a billboard in downtown Atlanta. It was a quote from a Delta pilot who said, "I want to thank the Delta organization for the best 25 years of my life." And it said, "Retired Captain so-and-so." And I almost went off the road and said to myself, who in the world, when they left an organization, would take out the money to put a billboard in downtown Atlanta thanking them for their career? And what it just awoke me to say, you know what, there are organizations that know how to do culture, that they can create a culture that is empowering to people and one that people are drawn to and not want to leave. And so every organization has a culture. The key difference that I find in my client organizations that are outstanding places to work is they're intentional about the kind of culture that they want to have. So I think part and parcel to what we're talking about today with time and culture is you have to address the cultural aspects of your organization if you're going to be able to be successful in retaining people. Many of you have probably heard about the Quadruple Aim. The Quadruple Aim was originally just the Triple Aim. The Institute for Healthcare Improvement developed this a number of years ago and said those three things are what we must be doing in healthcare. Well, along came the American Academy of Family Physicians about 3 or 4 years ago and said, time out, that those top three things are all laudable things and aim that we should have. But what's happening is it's at the expense of the care and the experience of our providers. We're killing our doctors. We're making them retire early. We're burning them out if we don't address the things that address their well-being in addition to the well-being of the people that they serve. So this begins to get at the whole idea of culture and what do you do about it. So part of my survey, I asked 2 questions of my clients. One, what are the symptoms? And then secondly, what are the strategies that you are employing? And I won't go through all this, you can read, but a lot of these are time issues. Sending cases out to vendors so we can reduce the workload. Hiring teleradiologists within our own practice who can take some load off of us. Incentivize additional shift work within the practice, flexible work schedules, end shifts on time, more home shifts. There's a whole lot of stuff there on that left side that deals with the organization, what they can do. On the other side is personal and emotional, which the organization obviously can address as well. But they talk about counseling sessions and wellness committees and looking at reward and recognition, a timely communication with our radiologists about what's going on in the practice. So these are some of the strategies that my clients are employing. I'm sure some of you have done as well. This is the model that I've used with all of my clients over the years. It's called the results pyramid. It was developed by the people who wrote the book called the Oz Principle, three authors, Connors, Smith, and Hickman. And it really simplifies for my brain the whole idea of culture. It really made it concrete for me because what it says is that your culture is determined by the beliefs and the actions of the people inside your organization. And what really determines how people, what they believe and how they act is how they experience your organization. And so if you want to look at one of the burnout strategies that would be helpful is we've got to look at what kind of a culture do we have. Every organization has a culture. But again, the great organizations are intentional and they look at this as a stepping stone approach. What experiences are we creating for our employees, for our physicians? And what do they believe about as an organization because of those experiences? And then what drives those actions is a sum total of that all creates our organizational culture. So we encourage our clients to revisit and re-engage their core values, to take a look at bridging this gulf between wellness and wealth, because what I hear from a lot of my clients is, you know, we really should be hiring more radiologists, but that's going to impact my income. There's really a values conflict. Do we want healthy, well-being, engaged, enthusiastic radiologists, or do we want tired people who really have trouble dragging themselves in every day? So we need to look and answer some of those questions. And then we need to define or redefine the desired culture that we want. What kind of culture do we want to have? And then what are the steps we have to take organizationally and individually to get there? So when it comes to culture, there's no magic bullet. There's no magic bullet for the time factor as well, but they're all considerations that you have to roll into your strategy for addressing burnout.
And so either coupled with strategy or as a component of strategy, we have to focus on time. We've talked a lot about it. The data suggests that we have to address the time and the conflict that occurs because there isn't enough time. And so I'm going to share a couple of slides with you to just sort of give perspective to really two approaches to time as organizational leaders. So for the first, I will share with you that I had an article. I was privileged to have an article published in the American Medical Group Association's Group Practice Journal earlier this year. It came out in February. And the article was entitled Pressed for Time. And again, as someone who comes at life and career and family and everything else from the standpoint of what I learned in manufacturing and what I learned in just-in-time manufacturing, I offer these recommendations, these 4 principles for enhancing your organization relative to time. And so the first is design the process for the skilled worker. We have to understand that everything revolves around the radiologist in this case. And so the process inherently was designed for the patient and for the expeditious flow of information to that is captured to the physician. And so we're a piece of that puzzle. We're a part of that process flow. The process was also designed for the protection of information. It was designed to be a record-keeping system, and then ultimately, now that everything is sort of public, I can get on and see my scans and my report from a radiologist instantaneously on my chart or some other means. And so the process simply was not designed for the person doing the work, the critical work of a radiologist or a physician. Eliminate time waste. It amazes me in every organization, we think we're efficient because we're busy. Busy and getting a lot of work done does not mean we're efficient. It does not mean we're not wasting time. And so time waste and understanding time waste and time loss is critical for a healthy organization. And embracing the relationship between quality, efficiency, and morale, add in patient experience because it's a component too. But if you're doing things right in your organization, your patient experience outcomes will be well. And then finally, if I'm making a culture in any organization, I'm starting with making time sacred. If I'm redefining my culture, I'm starting there because we have to respect the time of our team over anything else in order to truly position ourselves for success, because we've positioned each individual for success. And then Will, if you would go to the last slide, please. So the first time element is about focusing on your organization, having a right frame of reference and managing time well. The second part is equipping your physicians, your radiologists, for the effective use of personal time, or to actually have more personal time. I shared earlier that I've done a lot of physician research within our organization. We've generated a report from that. One of the questions that we've asked physicians is, on average, when you're using a service like ours, a service that is giving you time back, how much time are you saving? And so our physicians told us that on average, of all of the responses we received, on average, they're saving a day and a half per month by using a resource that was given to them by the organization. And then the range of time, some said an hour. One physician, and I remember this personal interview, it was a female physician. And when I asked her that question, she said, I'm saving 7.5 days a week. And she had quickly done the math of how many hours that equated to. And she looked at me and she said, I know that you're doubting that number, Bill. It doesn't sound possible. Before I could even say a word about it, she said, I know that doesn't sound realistic. Let me explain it. And she literally explained the time that she is spending with her kids on a daily basis and on the weekends doing the things necessary to have a healthy family and to be satisfied and keep herself healthy. And so the range of time saved when given a resource is somewhere between an hour and 7.5 days in a month. And so the point of this is that if you find ways and resources to give physicians time, they will access it and make the very best use of it. By the way, the article that I referred to, if you'd like to have a copy of that, you can get on the Group Practice Journal website and you can get it a download for $10. If you email me after the presentation today or anytime at this point, I'd be happy to send you one that we've sort of prepaid for. And so I could send you a free download if you'd like to access that article to learn about time management in your organization. But it's all about organizational time management and equipping your physicians with the resource of time. And ultimately, if you can solve for culture and if you can solve for time, you're going to solve for work-life integration in your organization.